So, Doc, do you have any points on any additional supplements to protect the body, such as milk thistle, or whenever you're using any of those compounds, or
Again, assuming that we're talking about protect yourself from use
preventative?
of
I think you signed up
testosterone and antibiotics.
preventative things, yeah,
Yeah,
over the counter.
the biggest one that has been around for a long time that surprises me that guys don't know about or use more often is a combination of what used to be just choline and inositol, and now we've thrown in L-methionine. We call them MIC caps for short. I learned about it first from a legendary bodybuilder, Franco Columbu.
Yeah, man.
The guys and guys that used to room with Zabo, some of the guys even before Franco would come in with a list of supplements, and it would be on that list. And I said, "Well, what are you taking that for?" And a lot of them would say, "I didn't even know, but Zabo told me to take it, and so I'm still taking it after all these years." That combination, the L-methionine is just an amino acid that really, it's a methyl donor, and it really just helps protect the liver in other ways. But choline and inositol, they get rid of the excess glycogen. It's a treatment for fatty liver, and it's a better treatment than any drug we have available for fatty liver. I can't remember the name of the drug. It starts with a U, but I flushed that drug a long time ago, the name of it, because it doesn't work anything close to this. Whenever the guys of old were doing steroid cycles, first of all, where does the excess energy, the glycogen, go first? Muscles. That's why you're using the anabolics, right? You want it to go to muscle. When it's super saturated, what's the next step back in the line? The liver. So a lot of these guys realize, hey, we're getting a fatty liver. So after they do a cycle, they do 30 days of what they would be considered, even today, high dose choline and inositol. Choline, I think, I don't remember which it is. They're all considered B vitamins. One's B80, inositol or choline, I don't remember which, but they're water soluble. They're very, very safe, and 3,000 milligrams of choline and inositol, along with half that, 1,500 milligrams of L-methionine, is now used very effectively for just 30 days after a cycle, or if you just have fatty liver for whatever reason. And a lot of times, one of the side effects, you'll see girls will use this, and they notice that, my skin got much nicer. Actually, sometimes initially you might have a little bit of acne for the first week or 10 days, but overall the skin will get better. And I dare anyone to take the test. Don't tell the person you're using to judge that you're taking this stuff, and say, hey, see how my skin feels now, and then even 90 days later continue taking it and see if they notice the difference. And that was getting to my point that you'll do the heavy dose, a 30-day dose, and then stay on the half dose for the off season or the rest of the year all the time, because it's just good for your liver and good for your skin.
Nice. That was a good question.
Now, milk thistle, sorry, that was a long-winded answer, just one supplement there, or combination. Milk thistle is also very good for the liver. It doesn't have that same mechanism of action on the liver, but it is liver protective. We've known that forever. Silymarin is one of the active ingredients that does a wonderful job protecting the liver from a lot of insults. N-acetylcysteine, or NAC, is another good one for the liver. We could extend a lot of spokes off this hub, because where do you draw the line between protecting yourself and just general health while you're using these things anyway? So maybe next time we can get more specific questions about supplements, because I'm your huckleberry if you want me to talk about the various supplements, and if I haven't heard of it, I'll look it up.
That's great.
Yeah.
Good question. Last question, Doc. Hi, Doc. I'm a big fan. I've been doing bodybuilding naturally since I was about 20. I'm now 27. I have never used steroids. I want to compete as a classic bodybuilder or physique, but I can't build enough muscle. I just don't have the genetics. I have a good build, but I'm not good enough to compete. My question is there any safe way to use steroids without any side effect? My goal is just to add 30 pounds, that's it, of muscle, and look like the physique guys do. Can I use steroids in a safe way?
Well, the gist of your question about using steroids in a safe way, the answer is yes. I mean, these things were invented long ago for different purposes, including all types of healing. It's obviously, they're called anabolic steroids for a reason. They're good for building tissue, anabolism in general, whether it's for burns or wasting. So yes, there are safe ways of using anabolics. That's for sure. And that's in the medical literature. The line drawn is, at this dose versus this dose,
Mm-hmm.
physiologic versus super physiologic, or not just that, but supraphysiologic for a time period to reverse a disease process or cure something or treat something, versus long term and just for cosmetic reasons. And again, it goes back into a lot of philosophy we'll skip. But the answer to the question is yes. Now, you mentioned, you chuckled, 30 pounds. That's a lot of meat, man. That's a lot of muscle.
I know.
That can be a lifetime of muscle for a lot of people. And I mean that as muscle. Weight, 30 pounds of weight, even for some that might be hard. But for a lot, that's easy. I mean, if you want to eat cheeseburgers and actually, slander cheeseburgers. What's wrong with a good cheeseburger? But, milkshakes and Cheetos and crappy foods, right?
Yeah.
I mean, you can put on the ugly weight, no problem. A lot of us can. It sounds like this guy is naturally thin, and there are good and bad aspects to that. The first thing I address with all people, 20 to 27 years old, 27 years old right now, you're still very, very young, still have some maturing of the muscle to come, but again, 30 pounds, that's an awful lot if you haven't built it in 7 years. Maybe some realisms in order there where it might not come on, although, again, I would encourage you to try if that's your goal. There are, you have to do the three basic pillars in all this. And this is a discussion I have with a lot of patients because they come in here and they say, hey, doc, I hear you know a little bit about this stuff. I was thinking about going on a cycle, and what's the difference between Anavar and Winstrol, I'm like, okay. And with all due respect, really, I love the enthusiasm. Who doesn't? And I'm an athlete. I enjoy sport, and I understand it all. But you got to very delicately take a step back and say, well, maybe we should push that aside right now and talk about, you need to eat right, you need to train right, you need to sleep right for a good 10 years before we start talking about the differences between Anavar and Winstrol. And I'm not being accusatory toward this gentleman at all. Again, it sounds like you put in 7 years, presumably of hard work, but I'm changing the question around a little bit so I can give a different answer, I guess, and have something to talk about. A lot of people come in, a lot of young people and old, thinking that steroids are the answer. Man, steroids are not. The guys that are champions at the best of their fields, whether it be bodybuilding or sprinting or whatever, that are doing this, they've got the basics down. Solid training regimens, balanced with solid eating and solid sleeping. Without those three, you can take all the steroids in the world, it ain't gonna happen. Look at your average 16-year-old guy in the U.S. anyway, who's fat and out of shape on the couch. You got tons of hormones flowing, but he ain't making use of them. So if I can drive that message home, maybe I turn that answer or that question into a winning answer. But again, without knowing more specifics, maybe you're an ectomorph, most pure combination, but pretty solidly naturally skinny. In other words, you might have to. Maybe I shouldn't give plugs, but there is a. It's not meant to be a plug. There's a. I've used it before for an actor who had to put on a lot of weight, like 30 pounds in 3 months. There's a supplement called Russian Bear 5000, which is a sick amount of calories if you mix it with the right amount of whole milk and whatever. That's one way to overcome the emphasis that the universe has placed on someone who's naturally skinny. You might have to eat your way out of that corner. Yeah. Maybe you're not training hard enough. You have to train your way out of that corner. A lot of guys, especially the older guys, that say, look, I don't want to be a bodybuilder, but I do qualify for hormone replacement therapy, or there's some ways I can put on 5 or 6 pounds and trim up. Sleep. Man, if you ain't sleeping, I don't care if you get up and you feel great. If you're not sleeping but 5 or 6 hours, you are not giving your body enough time to repair. So I don't mean to get up here and give the lecture.
No, it's great.
I see this all the time. Yeah. Repair those things first, and then if you're a professional and you want to go that route, then you start thinking about, okay, do I want to go into that other area of anabolics? But that has to be in place first, for sure.
That's great. Thanks, Doc.